Snoring and sleep apnea, officially known as sleep-disordered breathing, are medical conditions that can prevent us from getting the oxygen and sleep our body needs. Lack of adequate oxygen during sleep can adversely affect our entire cardiovascular system, as well as our brain.
So I had a severe and disturbing snoring and sleep apnea problem.
Not sleeping well can affect our daily life and our overall health. Snoring is not only annoying, but can disrupt the sleep of the bed partner in an unhealthy manner. Snoring and sleep apnea affects many millions of men and women.
Last summer, I was diagnosed with sleep apnea. I had had several episodes of waking up at night, short of breath with a racing heart, and that led me to a discussion with my primary care physician, who referred me then to a sleep doctor and a sleep lab.
I started in dentistry 40 some odd years ago and have been a general dentist for 30 years. However, in 1991, 28 years ago, I started doing dental sleep medicine, kind of as an aside. My wife and I pioneered it throughout the entire nation back then. We were one of the first dental practices to do this, and it has grown since then to be a worldwide field of endeavor. When signs and symptoms are present, such as snoring, gasping at night, daytime sleepiness, a sleep test is indicated to definitively decide if there's apnea or not. This test is typically ordered by a physician, and it can be done in the sleep lab or your home.
Specially trained dentists understand that no two patients are the same. That's why every patient receives a customized treatment plan.
Once the diagnosis has been made and it seems like the oral appliance is indicated, a specially trained dentist, a sleep disorders dentist, will do a thorough exam and begin appliance therapy. We utilize the latest digital technology to examine patients now. Instead of using the impression material that has traditionally been used for crowns and bridges and dentures, we do a digital scan. And it's much more accurate, it's less invasive, much more comfortable for the patient. When the appliance seems like it is working well, another sleep test is in order, again ordered by your physician, to see if it's working like we want it to.
Oral appliance therapy fits much like a sports mouth guard or orthodontic retainer. It functions by moving the lower jaw forward to help maintain an open airway during sleep. In this way, snoring and obstructive sleep apnea can be reduced. Although CPAP is an excellent therapy to treat sleep apnea, many people find it cumbersome and difficult to tolerate. The oral appliance is easier to tolerate, easier to clean, and easier to travel with.
I use it every night. I travel with it. It's easy to travel with. I don't sleep without it.
I'm pretty happy to report that since then, I have not woken up with a racing heart, no shortness of breath. I've not had restless legs or sleepless nights for that matter. And I would say the whole experience isn't as overwhelming as it might seem at first. You'll get through the sleep testing, you'll get through the appointment with your dentist. The whole experience isn't as overwhelming as it might seem at first. You'll get through the sleep testing, you'll get through the appointment with your dentist or your physician, and I would strongly encourage something as kind of non-obtrusive as the oral appliance for the treatment of sleep apnea.
Each dentist is board certified in dental sleep medicine, and each office is nationally accredited. Since 1991, the group has treated over 15,000 patients.